Thank you, Madam Deputy Speaker. It's 9:20. I've waited all day to be able to say what I'm going to say. In 3 minutes I can't give the speech I wanted to, but I had to come to speak up on behalf of my constituents in Bishop Auckland, and particularly those at the West Auckland dental practice who have just been told that they can no longer have NHS dentistry. If I could take us back 3 years, we saw 2 dental practices close in our area, one in Shildon and one in Bishop Auckland. A year later, a month before the general election, another practice sent out letters to the parents of children saying that because of how the NHS contract is funded and managed, as well as a national shortage, they said, we've come to the realisation that we are unable to offer NHS patients the level of care they deserve and will no longer be able to provide NHS dental services to child patients from the 1st of October 2024. So that was the situation that this government inherited: an underfunded service, a broken contract, and the reasons in 2006 for introducing it were sound at the time, but it was broken and needed reform, and off-rolling of patients. Now look, some things have gone well, and this government has made progress. On emergency appointments, it was right to focus on using the underspend because people were pulling their own teeth out and facing the most extreme cases. But appointments have not always been easy to come by and often require travelling across the county. Toothbrushing in schools is massively welcomed by dentists, less so by teachers, and appreciate the Secretary of State talking about this and what could be done to increase the take-up of that programme. The more dental places in dental training schools are welcome, and progress on the new contract, but many dentists are telling me that the care pathways pay less by the hour, and they're not sure if they will see the value in them. But we do have to be honest. The number of people with access to NHS primary care as opposed to emergency appointments has barely increased in 2 years. Overall, I will give way.
I thank the Honourable Gentleman for giving way. He's giving a powerful speech on behalf of his constituents and dentistry challenges in his area. He's talked about the contract. Others have referred to it today. It rewards activity at the moment and not prevention. Is that one of the things he'd like to see change in the contract?
I would like to see that change, and I would press the Minister today to not delay in bringing forth the consultation on new proposals around that contract. But in addition to reform, we have to be honest, we need to also bring funding levels back to where they were in 2010. Now, I met recently with dentists from across Durham, including one of the chief negotiators for the British Dental Association. They had warm words to say about the Minister. They felt that he's sincere and serious in tackling this, but they did feel that the resources are simply not enough. And as has been said already in this debate, that £1.5 billion a year is enough to fix NHS dentistry so that everyone in the country can have an NHS dentist. That's the equivalent of a 0.3% increase in national insurance, or £3 per month per taxpayer. This is not a large sum of money in the grand scheme of things compared to what could be saved if we didn't have so many people facing dental emergencies. And so I want to really press today that we have cross-party support on this, because it's all very well everyone coming here and saying that we need to reform the contract, and we do, but we need to face up to the fact that we need to fund NHS dentistry properly, and it is worth the investment to do so. And that's why it's an intolerable position to keep hearing opposition from the parties opposite to the investment that we're putting into the National Health Service. We heard just a moment ago a call for some of that £29 billion to be spent on dentistry. Then support the £29 billion, and yes, let's fund NHS dentistry.
Yeah.